You're listening to the Tooth Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Essenmacher, a fixed full arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results. Welcome back to the Tooth Sleuth Podcast, everyone. Greg Essenmacher here, but you know me, and if you don't, that's okay. Like, click, share, subscribe, do all the things you do so you can learn more about the business side of dentistry. Today on the show, I am super excited. I've been wanting to get this cool cat on my show, one of the best in the business, Dr. Farokh Jiveh. Dr. J, welcome to the show. Thanks for coming on, buddy.
Greg, it is an absolute pleasure. I've been waiting to come in and
Harass.
I remember.
Just say it. You've been waiting to come on and harass me. This is what you do. You come on and harass. Between you and Dar, like you both just harass me. Like I'm like the little brother that you like kick to the side of the curb and allow in whenever it's raining because you take pity on me. It's all right. I do the same. Dr. J, so, tell my listening audience about what you do. Like you have your own practice. I get it, right? You teach like the cosmetic dentistry, like giving people literally like weeks, months of one-to-one intensive training, like literally in a couple of days. But I don't even want to start there. I want to start on your personal transformation because I've gone through the same and others that have been on the show. So I really want to roll up the sleeves and dive into this. This is really the juicy stuff because personal transformation and then how we deliver to patients, to clients, to others that we work with and just experience with in life is really what it's all about. We can get to the other stuff and we will, I promise. Like we can talk about all that other stuff that, is the side that like of how we service others, but who we are as a human being. Talk to me a little bit about what that journey was like. Cause I know for you just a couple of years ago, right? You were battling your own internal demons, right? Fighting with going through divorce and all that. So I'm just going to air your dirty laundry right here. Talk to my listening audience about that and about that journey, please.
Absolutely. So first of all, I have learned and I have realized that every single person that wants to start living needs an awakening. It needs a shakeup. It needs a good kick in the ass. Stop being so freaking content because that's what I was. I had the money, I had the car, I had the big house, I had the wife, I had the 2 kids. I was showing up on Facebook. Look at me. Look at my car. Look at my date night with my hot trophy wife. Beautiful, beautiful mother of my children. Absolutely, I adore her. Look at me.
And
Look
how were you on the
I have
inside
become.
then?
I was. Can we cuss in here? I was. I was dying on the inside. I was just miserable. You know something? This is. I love this, and I was just reading up on this yesterday. Your ego, and I'm gonna go there for a second. Your ego wants you to be comfortable. When you're about to make a transformation, when you want something new, your ego is going to say, you know what? You're fine. You got the big house, you got the money, you got everything. You are safe. But safety was misery. It was for my ex-wife and it was for me. I am forever grateful for her to wake me up. And I just had to step back. I said, wait a minute. The single greatest thing that any person can also do when they awaken is to take responsibility. Take deep, deep look inside of them and say, you know what? Maybe it's me. Maybe it's me that I have to get to the next level. And that's exactly what happened.
And so for you, I really appreciate you sharing on that and what I know to be true, right? I've shared my story on here on this platform with you and others, right? So I've been sober for 21 years. And so there was a catalyst moment. For me, it was the educational variety, right? It wasn't the burning bush. It wasn't like, my second DUI, although I could have had many more. It wasn't that. It was just that educational variety and the moment, right? Because I had moments of clarity prior to what I have now as my sobriety date, hopefully for good, at least for today.
Yeah,
But that moment, right? It was a coming to. So was there a catalyst moment for you, just like
it
that
was.
moment, or was it some? Okay, please
Absolutely.
talk about that.
Absolutely.
Yeah,
When you are so fogged up, when your brain is foggy, when you are on that laser point that I have to get that CE, I have to get the office bigger, I have to do, you're on that journey. And then
that more,
that,
right?
that, that
The
more, that
disco
more what you
song
want.
or the rebel yell from Billy Idol. Your choice.
That's right. And when you're wanting more, that means there's a lack in your life, and you're just there. My moment was when we were in therapy, and my ex-wife, she arranged all of those things. And again, I keep talking about her because there were other events as well that kind of gave me an awakening, but she was the absolute beautiful catalyst.
Mm.
And the first time I ever heard the word co-parenting, it was at our therapy. And I'm like, okay, we'll go to therapy. This was my mind. We go to therapy and we'll do. I could tell, man, she's had enough of me. And I'm proud to say that we can't cuss. I'm proud to say that I'm a recovering a-hole.
Yeah.
And just the things, and not to, there's a whole difference between blame and responsibility. Responsibility, it builds future. Blame is just being in that blame victim mode. None of that. Responsibility. And I really realized that she had had enough of who I was, and it was time for me to wake up. And
Well, and
boy,
it sounds like what she was, right? Because what I know and what I've learned is that people, things come into our experience, right? For a reason, a
mhm,
season, or a lifetime. And for
mhm,
me, when I get into, we'll just say trouble, right? When I get challenged, when I find irritation, when I get frustrated, when I build resentments, it's when I try to move that person or that thing from one stage to the next when they don't belong there. And what you're describing, if I may, is you're talking about your ex-wife that was that catalyst of she was in one place, right? She was there for a reason, right?
yeah,
But not
yeah.
a lifetime. She still will be as the mother of your children. I think that's beautiful. So tell me a little bit about now this awakening that you've gone through. How is that showing up in the way that, because I know that you are an educator, right? You teach dentists on cosmetic dentistry. I know you do photography and such, which is the way to capture the beauty of the education of the cosmetics that you
Mhm.
teach to dentists in a way that's different from let's put together a big CE course, let's put together a bunch of slides and a bunch of your best cases and hide the fact that you have screw ups. Like, I mean, because that's just disgusting and it doesn't work for anyone. But
Yeah.
it's that one-to-one mentoring in your practice, intensive of, I think it's just a couple of days where it's really like a month's worth of education of being mentored in just a couple of days. How is that showing up, your awakening and what you've learned about yourself and how you show up
Mhm,
for now
mhm,
yourself and your
mhm.
kids, how that shows up in the way that you teach and educate others in the dental field?
I appreciate you asking that because that is such an important question. So it all comes down to the person. It all comes down to me realizing to be a leader of your team when you have 9, 10 different, completely different people to lead. You have to be able to lead yourself first. Everything comes from within. And they say, if you will, every chaos, and I really believe this, every chaos that is happening out there is because of the chaos on the inside. If
Mhm.
I was to put a projector on my heart and just show it around how my team is reacting to me, it's how I'm being. When you come to that moment that you are the gift, you are the one, you are the prize, you are it, your healing and your leadership will automatically allow others to rise as well. And you are going to start to attract the same energy people. You're going to start attracting patients that way because they feel your energy. It's not about chasing, it's not none of that stuff. So what I teach in those class, which literally people can save 10 years of CE of taking their patient. I took my patients, I flew my team to New York to learn from my mentor, Dr. Rosenthal, how to do veneers, how to do all of that. In 2 days, I will show them how to do that. But it's not about the procedure, it's about how to be. It took me a while to learn because we are taught in dental school what to fix, to do. Dentistry is feeling, especially cosmetic dentistry. It's not about feeling of look at this before and after. It's about how you're being present to your patient. Every patient, and I tell this in my class, every patient will literally give you the treatment plan. All you have to do is put it together. All you have to do is listen. The art of listening of what the patient wants. Honestly, I had a patient came in, kept talking about upper right, upper right, upper right. Doc, I want to talk about upper right. I said, okay, let's do a comprehensive exam. That's what we do. He goes, no problem. We did a comprehensive exam. I started telling her about upper left, upper left, upper left. And then I just wasn't listening. And that's why patients leave. And
Mm.
as soon as we addressed what she wanted, and it was important, she did everything. My case acceptance, this is the craziest part. Of course, I give them different option. My case acceptance is 100%. I rarely have, very rarely, it's close to 100%, but I rarely have people just leave because they feel the energy of the practice and they are attracted to it. You can't leave. It's
Right.
impossible.
Well,
And
and you just said, right? It's about being, right? I mean, we are human beings, not human
that's right.
doings, and there's different
That's
ways
right.
to go about an approach to dentistry. And what you describe is what our philosophy is and what we teach at GNA Consult when we're working with
Yes.
practices on the full arch, right? It's
Mm.
not about so much the what, right? The what is the product, the what is the cosmetic part, it's the denture, right? The fixed part of the denture. It's
Mhm.
the performance, it's the clinical aspect, but the why, the motivation behind the action. And that's what you're describing. You're
Yeah.
describing that being a better listener to deliver. If someone's talking about the upper right, the upper right, the upper right, and you're talking about the upper left, the upper left, the upper left, until you align with what they're trying to get at, you
Yeah.
don't have alignment. And you describe it as the energy, right, of attracting the patients of what you're trying to accomplish. And that's that shifting over to that values driven fee for service, changing the way that you show up for your team, your patients, for yourself, all of that. And it's really, and I'm going to use this word because I know that you'll vibe with it, right? It's all about really alignment, right? It's
Yeah.
about alignment and what I call the integrated self, every part of your life, from your personal life to your business life to your social life to your family life. And once you start to understand that, and become an integrated self, it's so much easier. I know I wasn't living that way, right? I was trying to remember who did I lie to about what, right? I call it the Instagram life, right? You put something up on social media and then behind the scenes you're miserable. That's not a
Yep.
way to live. And so living into that truth is something that you do. So where does somebody start, right? So those, because we see so much pain in dentistry, and I just gave a talk on this, and it was the phrase that I used was, it's okay to not be okay. And we
Yeah.
see
I
it
love
way
that. I
too often
absolutely love
in
that. Yeah.
dentistry, right? It's
Yep.
that people are struggling in silence, and it's not even, well, I mean, it's good that there's people talking about it from a stage. Granted,
Yeah.
that's great.
Yeah.
But it's
Yeah.
really about a dental assistant, a hygienist, and I have a very wide listening audience of different pieces of dentistry, right? They're in different roles in different parts of the dental field, of
Yeah.
really understanding that, hey, you know what? Yesenia, she's just not herself lately. And it might be just somebody sitting in the break room and saying, hey, what's going on? I'm noticing something's different the last week or two. Just
Yeah.
asking the question. Because there's been too many people in the last little while who have said to me, man, I wish I would have fill in the blank. And we've got to care for each other as, like you said, human beings more than
Correct.
anything else, first and foremost. Then we can be the human doings and all the accomplishments and are you finding that to be true?
I actually do. Yeah. And just to summarize my beliefs, I don't believe anyone can fix anyone, or I don't believe anyone can make anyone happy. People have
Mm,
their own path. The only thing, again, I'm going to go back to being self. The only thing we can do is to heal our traumas, heal our wounds, elevate our soul. Alignment, to me, is your soul finding the purpose of it, always wanting to do. It's your truth. And when others see that path, that there is a pathway, allow them and give them guidance to be, to just let go, and to allow. You can never tell someone on a stage. You can never tell someone in a lecture that, hey, this is how it is. They have to feel your energy of what you're doing. It's working, and it's the most beautiful thing. You have to live in your truth. You cannot fake this stuff. You have to live in truth. You have to become one with the universe, with God, whatever you want to call it. Become one with that and allow that to transfer to others. Allow them, let them to grab onto it. Some will, some never do. And it's okay. And we talked about this. The most important part of any transformation is the decision. Once you decide the how to, that will work itself out. So you just allow people to make that decision to say, you know what? I love that kind of energy. I want to be with that person. I want to be in that. Everything else after that is the how to, that it will come. You just have to allow it to come. All these, it's so funny, I have to say this, all these motivational speakers, let's say Tony Robbins, Wayne Dyer, um, Danny Morell, all of those people, if you listen to them, they say the same thing. And it's the truth. We talk about abundance and we talk about manifesting things. Oh my gosh, you just have to let go of your ego and allow it to come. I used to listen to that. It used to trigger the crap out of me
mm.
because I was attached to the result. When is it coming? Why is it not happening? I
Or
just
how
let
is it
it go
going to
now.
happen, right?
How is it going to happen?
Yes.
That's in the mind. You have to go through your heart. Allow it. Man,
Yeah.
I shared this on our call last night. I have to share this really. It's a little woo woo, but just go with me here. I shared this a little bit on the call. There's a park that I go walking every time. This time I said, you know what? Screw it. I'm going to ground. I took my shoes off. I took my socks off. I get emotional thinking about it. I just let it go. I just gave myself to nature. I started walking in the middle of a park. I'm finding myself sobbing. I'm like, what the hell is going on? That was 2 days ago.
Mm.
They say you should not be the same person in 40 every 48 hours. And I just realized how beautiful it is to just allow, to just let go and allow the universe to give you what you always wanted. Just open your heart. And I'm going to go back to the leadership. When what we do, we show our energy to our doctors that come in, how we should treat the patients in an absolute service oriented. This is what we can do for you,
Mm-hmm.
and allow them to decide. Let them feel your energy. And I'm not talking about hype, I'm talking about that beautiful light that every one of us have inside of us. We're just clouding it with our own stains, and we don't let that light come in. Just let go, man. Just let
Yeah.
that, just
And
clean
how
that up.
transformative that is, right?
Oh
That
my God.
cycle of every 24 hours. I always like to say I always know when I need to have a good cry, right? Because how cleansing that
Oh,
is as well, whether it's
beautiful.
grounding, cleansing with the cry with others, doing it through getting quiet. With as busy
Yep.
as our lives get, I think it's critically important to have
Yep.
that reset,
Yep.
right, as human doings of
Absolutely.
being more of human beings. And I think that's critically important. Well, Dr. J, this is the point of the program that all of my guests over the 140 plus episodes have played a little something called What the Sleuth is Going On. It's 3 rapid fire questions. It's
Oh
the
my
first
gosh.
thing that comes to mind. Are you ready to
Okay.
play?
I'm a little nervous now, but no, I'm just being, let's let's go.
All right, here we go. Question number 1. What's the worst bad breath you've ever encountered?
Okay. I can tell you that. I can tell you that it was one of my patients. God bless him. He was older gentleman. He has passed on, but I had a mask on. I literally had to put double mask on. It was the worst perio breath I've ever experienced, but we fixed him up. He was fine, and he's he's gone. And he's such a sweet soul, and he has a really special place in my heart.
Yeah,
So it's
perio
all
breath
love.
it's at the top of the list. I mean, when I did the 100th episode and we accumulated all the answers for the first 99 guests, perio breath was definitely in the top for sure. And most clinicians, anybody who's in clinical, definitely talks about perio breath for sure. Okay, question number 2. If you could change one thing about your smile, what would it be?
About my own smile,
Mm-hmm.
I, it's my own insecurity. I have a little misalignment on the lower, and it's I'm thinking about becoming a aligner patient. Very, very minute. It's me.
I
Yeah,
mean, you're a
because I
cosmetic dentist. Of course you're going to
I
be a
know.
perfectionist.
I know. But yeah, if that's pretty much it. The little bit of misalignment on the lowers, which
Okay.
great
Question number
questions.
3.
I'm
Thank
digging
you.
this.
Question number 3, last and final. If you could
Woo!
go back and be the inventor of any dental product and no, you can't choose your own, which one would you choose and why?
Oh my gosh! Now you're putting me under. Okay, if I was to go back and invent something, ah, now it hasn't been invented, but we do a lot of surgeries in our practice as well. Something that would make that easier. I know there are easier way than just taking a forceps and just taking the teeth out. I hate to end with this, but if there was something, now it has come close. My laser has come close to working things so beautifully, but that's the only thing. You know what? It goes down to I have my pleasing ways that I want to make everybody happy, because that's the one thing my patients don't like. But if that procedure could be easier, which besides IV sedation, because not everybody can get that, but that would be the only thing. That would be the instrument. But I don't know. I don't think it's been invented yet. But my laser has come close.
Fair. All right. Well, Dr. J, I want to respect your time and my listening audience. We're getting close to the end. In the last few minutes, is there anything I haven't asked you that you're just dying to share with my listening audience today?
Yes, why am I wearing a ring when I'm not married? Go ahead, ask me that.
Uh, Dr. J, why are you wearing a ring when you're not married?
Okay, so let me tell you this. I told you about my ex, and the way I found out about it, this is my wake up call. I am not taking this is not my wedding ring. It's my wake up call. It was after a trip to Colorado with the family. And that's when I really got it. I got what's happening. And then I'll end with this. This is something I have not shared, but I will share here. At my highest energy, I attracted the most beautiful soul. You know, people talk about soulmates. I learned the definition of what a soulmate is. And oh, she
And
just
it made
she
you speechless. And anybody that knows Dr. J, anything that can make him speechless, wow.
oh my god, oh my gosh.
That's a beautiful way to wrap the episode with Dr. Farokh Jiveh on the Tooth Sleuth podcast. My friend, if they're interested in learning more about you, in learning more about the education that you do, or just in general, what's the best way for them to get in touch with you, my friend?
Okay, so I do have we pick our clients. We want to make sure there's alignment. So
Sure.
there is a Zoom, since it's a one-on-one and there's low number of people, maybe two, three doctors, sometimes one. So we do have a Zoom interview, and all the forms are at palmbeachdental'academy.com, just like the
Perfect.
city
Yep.
of Palm
And
Beach Dental Academy.
yeah, and we'll get that in the show notes to make sure that people can find you in that way. Awesome. My guest today has been none other than Dr. Farokh Jiveh, my good friend. Thank you so much for being a guest on the show. It's been an immense pleasure and honor having you
It
on today, my friend.
Oh my gosh, it has been true pleasure. Thank you so much for the opportunity, for the time, and it's so great. I can't wait to see you in person next time. And thank you so much, Greg. Really appreciate
Be
you.
well, my friend.
All right, take care.
If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.